Welcome to the Seconds for Good podcast. My name is Maureen Ideozu, and I'm the founder and executive director of Seconds for Good Charity Initiative, S4G for short. Today, we're going to have a conversation that is a bit unusual, the one most women will never have a chance to have with a doctor, which is not clinical, which is not rushed, they're full of terms where you have to go and find Google to interpret afterwards. I have here today my guest, Dr. Gift Tom George. She is an obstetrician, a consultant obstetrician, and gynecologist. She's been a volunteer since 2023. In fact, she's the first volunteer with Seconds for Good. She believes, like we do, that the right information at the right time in the right hands ensures that lives can be saved. So, Dr. Gifts, you're welcome, and I'm really glad you're here. Good
Thank
morning.
you very much. Thank you for having me.
Thank you. So, before we get into anything clinical, you choose to give your time and expertise to S4G. Why did you decide to volunteer with us?
Thank you very much for the question. When I saw the flyer and posts on WhatsApp about the missions and visions for S4G, how is to reduce maternal mortality in IDP camps and undeserved communities. So I told myself I need to be in this project. So this will actually help to reduce the number of referrals we're going to have in the teaching hospitals and also complications that women come down with. So I felt I should try and see these women in their states, in their comfortable states before anything gets bad. So that was why I decided to volunteer.
Yes, you just mentioned the hospital. So you work in a university teaching hospital. I can only imagine the complex cases that come to you there. Thinking about the women you see in your practice and the women S4G works with in underserved communities, can you paint a picture of their understanding and approach to maternal health issues?
Okay. Firstly, every pregnant woman, irrespective of their cadre and where they are, the their aim is to have a seamless pregnancy, seamless delivery, and deliver a healthy baby. That's what comes to the mind of every pregnant woman. Now, when we come to the teaching hospital, we have a mixture of the knowledgeable and those that come to the hospital because they are being forced in the sense that they are coming in because they already have complications associated with pregnancy or their delivery, and even sometimes the immediate postpartum period. Now, in the teaching hospital, we see both the calm cases and the very bad ones who are referred from these communities that have been mismanaged in pregnancy and in their delivery. And also in the teaching hospital, you also see those that are very knowledgeable that know that yes, they are pregnant, they need to have antenatal care and they need to see the specialist to attend to their baby. So it's a mixture of both for the teaching hospital. Now for the IDP camps with the S4G, most of them do not believe in antenatal care. They feel that they are pregnant, the pregnancy will be seamless, they are going to give birth, and most of them prefer giving birth at home because they've actually not had any complications. So that's the difference between them. However, their endpoint is to have a safe delivery. That's what both of them aim to have at the end of it all.
It's quite distressing thinking about the women in the IDP camps because those are the statistics that are not captured. They're not captured. There's also probably no follow up because they don't end up in a hospital. So they just say the child is gone. God gives and God takes, and they
Exactly.
move on.
Yes.
Very sad. We have our work cut out for us. Sadly so. We're marking the World Immunization Week, 24th to 30th of April. We're right in the midst of it now. Let's talk about immunization for pregnant women. At what point should they have the first one, and what is it called?
Okay, yes. For the common immunization or vaccine that is given in pregnancy is the tetanus toxoid vaccine, and it's important that every pregnant woman should have this vaccine. In fact, most especially, they can even have this tetanus toxoid vaccine before they get pregnant. They can even complete the 5 doses before they get pregnant, and then probably get a booster dose depending on how long they had the last dose. Now, When a woman have not had the vaccine at all, at the first contact with a health practitioner, the very first time this woman comes to a health center to book for antenatal care, she should have her tetanus toxoid vaccine, and she should have 5 doses. Although the 5 doses, she's not going to have it all during the pregnancy period, because it's going to last is in bits. So the first dose is at the first contact. Then she's going to have the second dose after 4 weeks of the first contact. And then the third dose after 6 months. The fourth and the fifth doses are a year apart, a year after the third dose and a year after. So
Takes
this
about
tetanus
3 years,
toxoid. Yeah, so it takes
basically.
about 3 to 4 years to have the complete 5 doses of tetanus toxoid. So even after pregnancy, after they've delivered, they should still continue to take the vaccine to complete it. Yes.
So, what is the behavior of pregnant women towards taking vaccines? We've heard that there's a lot of fear around vaccines in pregnancies. The most common one being, will my baby, my unborn baby, be harmed with this? So, what is the answer, the honest answer to that question?
Okay, yes. Once a woman is pregnant, she's careful about what she takes into her body, what she eats, what she injects. So it's common for them to have that fear if the vaccine will not harm their baby. But the major thing is for them to know that tetanus toxoid vaccine is harmless. It's harmless to them and it's harmless to their baby, and is in fact very protective for their baby, because once their baby is born, this the vaccine gives a passive immunity to their baby, such that their baby has this immunity for the first few and even few days of their birth, first few weeks, first second week of their birth. So this vaccine serves as the immunity for the baby for until they start getting their vaccine. So it's very harmless to the baby. So it's nothing for them to fear about.
When a pregnant woman is vaccinated, she's essentially doing something good for two people.
Yes, she's essentially doing something good for herself and her baby, because this vaccine, when they are vaccinated, the mother releases antibodies through the placenta to the baby. So that now acts as the passive immunity for the baby. So there's actually a transfer. You know, when a woman is pregnant, most of the what the baby gets is from the mother and is transported through the placenta. So when this woman is vaccinated, the antibodies also passes through the placenta to the baby. So the baby gets a passive immunity. So it's for both of them.
Okay. So, coming back to tetanus toxoid, explain neonatal tetanus to someone who has never heard of it. What is it? What it does to the baby, and why a single vaccine can stop it?
Okay. Neonatal tetanus is actually a preventable bacterial infection. It's a preventable disease, and just the vaccine, let's call it just the vaccine, tetanus toxoid, can help prevent it. Now, what how can a baby get? Let's just start from how the baby can get neonatal tetanus. Now, when the delivery is done in unsterile environment, especially these women that want to deliver in the house with traditional birth attendants that have unsterile environment, there is an unsterile environment, and their instruments are unsterilized, and they happen to use this instrument to also cut the umbilical cord. That's the cord of the baby. That's the connection between the placenta and the baby and the mother. I think every woman should know the cord. So one, they use this on sterile instruments to also cut. And even after delivery, so women use ash to place on the cord. They use menthol. Some people even use toothpaste. So all these things are unsterile. So when they use all this on the baby's cord, and there's the bacteria, the tetanus bacteria is in them. So this now gets the baby infected, and the tetanus even gets to the brain. Now, what happens with neonatal tetanus when the baby is infected? There's a there's pulse shock, the baby comes down with fever, the baby comes down with spasms, the baby comes down with a locked jaw. That's typically what tetanus toxoid is. And they have these painful convulsions. Even light can trigger the convulsions, sound can trigger the convulsions. So the basic thing is, once a woman notices their baby is having convulsions with light exposure, sound, or the baby is not even sucking well, they need to even get to the hospital as soon as possible so that immediate treatment would be given. Neonatal tetanus is actually deadly. However, when it's prevented or treated immediately, the baby can actually pull through.
That's about the right information, right time,
Yes,
saving
the right
lives.
information at the right time.
Yes.
Yes, that's
Okay,
it.
that's very interesting to know. Thank you. So, beyond tetanus, what else should every pregnant woman in Nigeria be receiving? And what is each one protecting her from?
Okay, for in Nigeria, basically the vaccine that pregnant women get is tetanus toxoid vaccine. However, there are other vaccines that pregnant women can get. The COVID-19 vaccine is safe in pregnancy. There's the RSV, that's the respiratory syncytial virus vaccine. It's safe in pregnancy. It prevents the woman from respiratory syncytial virus. It's a respiratory virus that can affect the respiratory system. And also, it can also get the influenza vaccine. It's also safe in pregnancy. Now, the influenza, although all these vaccines are not given routinely, they are not routine vaccines that are given in our environment. However, these are the vaccines that pregnant women can also take. Now, for the influenza variant vaccine, it can be given about the second and third trimester, not the first trimester. Now, there is the Tdap, the tetanus, diphtheria, and pertussis vaccine that can prevent pertussis or whooping cough. So a pregnant woman can also get those vaccines. But basically, the routine for every pregnant woman is the tetanus toxoid vaccine. But all these other one can also be given in epidemics, and when there is an epidemic of all
These
these
diseases.
diseases.
Okay.
Yes.
All right. So, what happens after the baby is born for the mother's own immunization and for the new baby?
Okay, so are we if we're streamlining to tetanus toxoid vaccine, for example. Now, if when the woman first says, as I said, it has 5 doses they would have completed. Now, these doses actually has immunity for specific time. Now, the first dose does not confer any immunity to the mother. The second dose confers immunity for a space of that's 3 months. Now, the third dose, which the woman takes after 6 months, can confer immunity for 3 years. The second dose confers immunity for 3 years. The third dose confers immunity for 5 years. The fourth dose can confer immunity for 10 days, while the fifth dose can confer immunity for the woman for life. So when the woman have completed her five doses, she has an immunity for life. Now for the baby, when a woman is pregnant, she would have at least had up to 2 doses during pregnancy, the first dose and the second dose. And as I said earlier, the vaccine transfers antibodies to the unborn baby. Now, this baby gets, when the baby is born, the baby has a passive immunity which lasts for just a few weeks. So afterwards, the baby continues having his or her vaccines afterwards. So for the vaccine that is protective for tetanus is a pentavalent vaccine, like a 5-in-1 vaccine, which the child has 6 weeks, 10 weeks, and so the baby shouldn't stop because the mother have had the tetanus toxoid vaccine. The mother should continue with the national immunization program.
Okay. So, the vaccines are easily available though with national
Yes,
insurance. Okay.
yes, they are easily available. Yes, they are easily available.
Okay.
They are easily
We're
available.
actually very happy at S4G because we're able to attract the FCT health insurance scheme to the primary health center in Pigba where we work with the women. So they're all getting it for free now. They've been registered to have their insurance for free. Okay, so now let's talk about myth versus truth. You touched about this a little bit earlier that the women prefer to have their babies and at home and all that. So it is a big issue. A woman will tell you her mother, mother-in-law, or neighbor, they say that she not take injections during pregnancy and she trusts them. She does not fully trust the health system. In your experience, what is the single most dangerous thing women believe about vaccines in pregnancy that is simply not true?
Most people feel that when they receive vaccine while they are pregnant, that their baby will be malformed that they'll give birth to deformed babies. Some people believe their baby will die, but mostly that their baby will come down with one deformity or the other. So it still goes back to what I said earlier. Pregnant women are careful of what they take. And so once, and when a woman is pregnant, she tends to like take everything she hears because she wants her baby to be safe. So in whatever you tell her, do this, oh, she adheres to it. Oh, don't do this, she adheres to it. So once they hear from their relatives who is always with them, kind of, they tend to adhere to them. But the major thing that every pregnant woman should know that tetanus toxoid vaccine is safe. It is harmless to their baby. In fact, they need it for their baby to get that passive immunity for their baby. So that's it.
Thank you. So, social media has made vaccine hesitancy faster and louder. What is circulating right now that worries you most as a clinician?
Okay, I know, let me just digress a bit. You know, during the COVID-19 vaccine, there were rumors that they want to give us this vaccine so that we'll be wiped out of the country. Some people say they're bringing in these vaccines because they want us to be dependent. Some people say the vaccines are here so that we'll come down with a particular disease so we can also buy the drugs that they produce. So these are the myths that we hear. Some people say, oh no, those vaccines, they are not actually protective of anything. There is actually an infection they are giving to us so that we don't we are wiped out. So there are a lot that are being said about vaccines, but the major thing is don't depend on social media in whatever you're doing. Always seek um your health practitioner's advice. But unfortunately, these ones in the IDP don't tend to get enough of health practitioners, or let's say qualified health practitioners to even talk to. So they still end up getting the wrong information.
Information. So, I'm on the last question now. So, immunization week theme this year is for every generation, vaccines work. If you could speak to every pregnant woman in Nigeria right now, the one who is unsure, the one who is scared, the one who hasn't gotten around to it, what would you say to them?
Vaccines are helpful and they work and they will help you and your baby get vaccinated. That's just it.
Dr. Gift Tom George, thank you very much. Information this clear, this direct, this free is itself a form of healthcare. This has been the Seconds for Good podcast. If you're pregnant right now or you know someone who is, share this episode. Not because we asked you to, but because it might be the conversation that changes something or everything. So we'll see you in the next podcast. Thank you.